All right, welcome everyone. My name is Tricia Reid and I'm your host, and this is my guest, Dr. Harry Adelson. How are you?
Hello, so nice to be with you, Tricia.
Thank you. Thank you. I got to meet Dr. Harry back in January, and I'm super excited to say that not only did he get to work on me, he's now agreed to do this amazing interview. Dr. Harry, I'm so pleased with the work you're doing. Can you tell us more about
Sure,
this?
sure. So I ended up going to naturopathic school. I went to the National College of Naturopathic Medicine. I started in 1995, and what got me interested in naturopathic medicine are the six guiding principles, the philosophy of naturopathic medicine. And it was really in reaction to big food, the big food industry, because this was back in the 90s, and that's really when obesity was really gaining traction. I just sort of saw the problem as being the food industry. So the reason I went in originally was to take on big food. Well, it didn't work out that way, because what happened was at the end of my first year, I had a bad shoulder injury. I was training for a rock climbing trip to France. And I did this hard cross through move in the gym, and I felt this pop in my shoulder. And it was very painful. Went and saw a surgeon, had an MRI. The surgeon said, well, you've torn the labrum in your shoulder. You've torn the cartilage. I can put a scope in there and cut it away, which will help in the short term, but it's going to give you problems later in life. Similarly, an alternative would be to inject your shoulder with steroid. It probably will give you short-term pain relief, but it's actually going to contribute to the problem because it further degenerates the tissue. Well, this didn't make any sense to me at all, because here I was in naturopathic school. I was learning about the healing power of nature. I was young, I was healthy, and to say that my only options were a steroid injection or surgery just didn't make any sense. So I started sort of asking around in the community, in the naturopathic community, and this was back, in the mid 90s, when doing research meant you actually had to talk to people. And I found out about Rick Marinelli, who was the first naturopathic doctor to perform regenerative injection therapy, which is the predecessor to stem cell therapy. And so I met Rick. He became my mentor. He taught me regenerative injection therapy. He taught me how to kite surf. And he injected my shoulder with prolotherapy, and I had experienced a complete cure. Prolotherapy is the injection of natural substances that are simultaneously nutritive and slightly irritating. So basically, you're tricking the body into thinking that it's suffered a new injury without actually causing any tissue insult, thereby launching the body's natural healing cascade. So I did that for the first really 6 years of my practice. I did prolotherapy. Then platelet-rich plasma came along. Platelet-rich plasma is very similar to prolotherapy, but instead of using like a dextrose sugar solution, we use a person's own blood product. We do a blood draw. We concentrate down the blood platelets. Platelets are what are responsible for clotting after an injury, but they also launch the healing response. They release these proteins, the most important of which is called platelet-derived growth factor. And those actually trigger your own stem cells in your tissues to go into healing mode. So for a period of about 4 years, from 2006 to 2010, that was my entire practice, was doing platelet-rich plasma. And then in 2010, a patient of mine, a woman named Laura, who I treated for years. She had this bad knee injury. She'd had this traumatic knee injury, and I treated her over the years, and I'd helped her to a point, but we could never quite get her all the way there. So anyway, she showed up to my office, dropped a stack of papers on my desk, all copies of research trials, and mostly animal trials at that point. And she said, I want you to inject bone marrow stem cells into my knee. And I said, Laura, I don't know how to do that. And she said, well, so learn. I said, Laura, do you know how much criticism I'll get as a naturopath if I start doing bone marrow stem cells? And she looked at me and she said, well, I'm a materials engineer for NASA, and I'm a woman. So if you'd like to complain to me about people telling you you're out of your league, I'm afraid you're talking to the wrong person.
I love it.
And I couldn't argue with that. So I learned how to aspirate bone marrow. and it worked so much better than prolotherapy or platelet-rich plasma. I knew that's all I wanted to do. And so that was back in 2010, and it's evolved to the treatment that you got, which is combining stem cells from bone marrow with stem cells from fat with exosomes, and yeah, and that was the treatment that you got.
So is it always being extracted from the hip bone, or is it extracted from different parts of the body based on who it is?
Well, there's different, so there's two main categories of stem cells. There's autologous, which means donor and recipient are the same person. So that means stem cells from your own body.
Mm-hmm.
Then there's allogenic, which means it's from a donor.
Mm-hmm.
So we'll go back to autologous. From your own body, the two tissues that are very rich in stem cells and that are relatively easy to harvest are bone marrow and fat. Bone marrow is the workhorse. That's the gold standard. It's what's been around the longest because it has been used for so long in the treatment of cancer with certain cancer treatments. It's just considered an off-label use. When you use stem cells from fat, you get a much higher volume of stem cells. I have found that using the two together seems to work the best. I think there's constituents to bone marrow that you don't get from fat. The issue with fat is it's a little bit of a gray area legally. The FDA is trying to prove that stem cells from your own fat are in fact a drug. And there's a big lawsuit right now. The guy who's the most famous adipose-derived stem cell doctor, a friend of mine, Mark Berman, is in this lawsuit. And if my friend wins, we'll continue doing fat. But if my friend loses, then we'll have to stop doing fat. So there's the autologous, or bone marrow and fat. For the allogenic, that's where a lot of people are using umbilical cord stem cells. What people say about the use of umbilical cord stem cells is that they're very young and robust. Whereas, like for me, for instance, my stem cells are 52 years old. So why would I want to use old stem cells when we could use these very young, robust stem cells? Well, the reason I personally don't really like using them is because we don't really know what the long-term effects are of taking somebody else's genetic material into your body. You can have a graft versus host disease from a bone marrow transfusion like 2 years later. So we think that those umbilical cord stem cells are safe, but we really don't know for sure. So what we use with you, which is sort of a compromise, is we use exosomes. And what exosomes are, the company that I use derives these exosomes from placental stem cells. So they take these placental stems. So these, women give birth to their baby, then they have the placenta, which normally would just go in the trash, right? It's just considered medical waste. Well, they donate the placenta. The tissue's tested for every known communicable disease imaginable. And if it's without any disease, then the stem cells are harvested. And what these laboratories do is they put these stem cells into a stressful culture medium. So they basically trick the stem cells into thinking that their host is under duress. Well, these stem cells then manufacture these vesicles filled with growth factors that are called exosomes. Now, when I was in school, we thought exosomes were cellular waste. We thought it was like the poop of cells. Well, what we've since learned is that that's actually the communicating proteins. And the superhuman power of stem cells, it isn't even so much their ability to turn into different types of cells. When used therapeutically, the superhuman power is this thing called the paracrine effect. The paracrine effect is the stem cell's ability to communicate with damaged tissue and tell them to go into healing mode. And those growth factors are contained in the exosomes. Now, what makes my stem cells 52-year-old stem cells is as we age, our stem cells lose the ability to manufacture these vesicles filled with growth factors. So what we do here is we take your bone marrow and fat stem cells and then supplement them with these very robust placental exosomes. And what we think happens is your own stem cells absorb them into themselves, thereby effectively making your stem cells that of a younger person.
Fantastic. Okay. And so will somebody's daily ingredients affect this result or an anticipated result? Kind of going back to the conversation about the food industry that inspired you originally, it just brings to mind, unhealthy versus healthy ingredients and
Mhm.
that foundation for a healthy baseline starting off.
Yeah, sure. So I've been in practice for 20 years. I've been doing stem cells for 10 years. And what I've found is that, I don't help everybody, right? I'm very careful who I select. We help a lot more people than we don't help. But the reason I'm so careful in who I select is this treatment doesn't work very well in people who are not healthy,
Mhm.
because what we're depending on the function of your own stem cells. Stem cells are present in all of our body tissues, and their job is to maintain the health of their microenvironment. So what we're doing is we're just taking the stem cell from an area where you still have a robust population, supplementing them with exosomes, and then putting them into the place of suboptimal healing. Well, if your own natural healing response is suboptimal, it's not going to work very well. We can move those stem cells around all day, but if people are leading an inflammatory lifestyle, if they're not exercising, if they're not sleeping, we just don't get good outcomes.
Got it. Okay. And so, how does this show up with acute versus chronic inflammation, you know, for the person coming in to get the treatment?
Mhm. Well, the people who I see are the most chronically inflamed are drinkers. That's the thing that I really find kills stem cell function more efficiently than anything is alcohol consumption.
Wow.
So if people are heavy drinkers, I counsel them to take at least a couple of months of going cold turkey before doing the treatment. We just don't do well with habitual drinkers, and I think it's because their whole system is just in this inflammatory state.
Hmm. Hmm. Okay. So what situations have you seen where this wasn't a successful, answer for someone?
Hmm. Well, clearly people who are not in excellent health. I would like to just back up a little bit because you were asking about chronic versus acute
Yeah.
inflammation. And the thing that to remember is acute inflammation is mandatory for proper tissue healing to occur. So inflammation in certain settings is not necessarily a bad thing, and you don't really want to suppress it. We were just, when you were here for your treatment, we had the conversation about how we ask people to avoid the use of anti-inflammatory drugs. The issue with anti-inflammatory drugs, now, if you just do like a dose or two here and there, it really has much more of an analgesic effect. It takes actually several doses over several days for it to exert an anti-inflammatory effect. But when you block the inflammatory cascade, you're blocking the same mechanism by which normal tissue healing occurs. So I'm not a big fan of the non-steroidal anti-inflammatory class of drugs, because and I can't say this with complete certainty, but from a regenerative medicine perspective, it's actually you're swimming upstream. It's disallowing the normal tissue healing to occur. So acute inflammation is not necessarily a bad thing because that's what launches the healing cascade. It's the chronic inflammation where it becomes a problem because then you're just sort of stuck, and that's you're not getting into the later phases of healing, which are the regenerative phases.
Mhm. So something that I noted when I was filling out the paperwork, it wasn't it signing all the disclosures and all of that, but there was a part that mentioned that this wasn't for cancer treatments. And while I wasn't there for a cancer treatment, is that something you guys work with?
Yeah, we only treat musculoskeletal pain. So we do a
Mhm.
lot of spine pain. That's sort of what sets us apart is the advanced work we do with spine, injecting intravertebral discs, doing epidural injection of stem cells, not steroid epidurals, but stem cell epidurals. And then, the entire length of the facets of the spine.
Mhm.
and major joints. So we only treat musculoskeletal pain, arthritis, post-whiplash, low back pain, that sort of thing.
Mhm.
There are people treating every imaginable type of malady. If you can think of an illness, there's people treating it with stem cells. For people who are interested in sort of treating systemic disease or that sort of thing, I recommend people check out the Cell Surgical Network, who I'm a part, the group that I'm a part of. I think their website is stemcellrevolution.com, and they list doctors all over the United States who treat, in all different areas of specialty.
Mhm. Okay, so what have you seen the best success with, like athletes, or I mean, you have a variety of clients that I've seen, especially in your documentary that came out. You definitely have a lot of testimonials on that. Where have you seen the biggest success, the biggest
Well,
outcome?
people like you, people who are leading healthy lifestyles, who have chronic musculoskeletal pain, either caused by traumatic injury or sort of repetitive stress or that sort of thing. Um, Low back pain, neck pain, arthritis, that sort of thing, just normal wear and tear. And the thing that is that's sort of an important thing to consider when we're talking about this is this whole concept of what is the pain generator. Because the issue that we run into with conventional medicine is we have in conventional medicine, we have this third party payer system, which is insurance pay medicine. And the problem with that is what ends up happening is, in order to, so like you're my patient and I'm the doctor, but then here's this insurance company. And so suddenly, like, they're my client and you're sort of just a, a good, right?
Yeah.
What my client does is, in order for them to pay me to treat you, they require evidence that, I need to justify the treatment. And the way you have to justify the treatment of pain is with objective findings, diagnostic imaging. So, for me to treat your low back pain, we have to have an MRI that shows X, Y, or Z.
Mhm.
The issue with that is, if you look at people with no low back pain, people who've never had low back pain, and you do MRIs on these completely asymptomatic people, 60% of them will have abnormalities on MRI. 15% can have abnormalities so significant that if they were in fact symptomatic, they would be candidates for immediate emergency surgery, but they're not. Similarly, if you look at people with lots of low back pain and neck pain, a lot of times their MRI is perfectly normal. So this calls into question, where is the pain coming from? Because
Mhm.
if it's not from what we can see, because the MRI is amazing, it's like, it's not X-ray, but it's like, it's X-ray vision. I mean, you're seeing all the tissues in great detail. But the problem is, what you see on the imaging isn't even necessarily predicting anything. It's not predicting whether or not the person's experiencing pain at all. So what that does is it shifts the focus from what I call the macroscopic to the microscopic. So the macroscopic would be, say you have a fall and your leg hurts, and you take an X-ray and you have a broken leg. Well, that's the problem. That's the macroscopic problem. But most chronic pain conditions are occurring on the microscopic level. When people experience suboptimal healing, when they have a traumatic injury that doesn't completely heal, or if they have just sort of like a repetitive stress and they never have the opportunity to get better. I see this with a lot of people who work hard manual labor and never take rest days, especially like farmers or ranchers. Like, they don't have rest days, so they just are constantly working. So they're breaking the tissues down and they don't build back up. So what happens with that is, there's two main changes that happen on the microscopic level. One is the collagen matrix becomes chaotic. So the connective tissue that is our core substance is a miracle fabric. It stretches just the right amount in each direction, and the nerves that pass through it pass freely through it without getting caught up. Also, you have just the right amount of microcirculation, the right amount of blood flow bringing nutrients to the area and metabolic waste away. Well, what ends up happening when you have suboptimal healing is there's two main things. One is that miracle fabric loses its miracle properties. It stretches too much in some directions, not enough in others. And those nerves that pass through the fascial planes get caught up and fire pain signals. The other thing is a phenomena called neovascularization. And what that is it's the growth of new abnormally formed blood vessels. So it's a hyper concentration of abnormally formed blood vessels. Now, we've known about this for years in like tennis elbow and that sort of thing. But recently, we've discovered this happens in arthritis, and it happens in spine pain too. It happens in pathologies of the spine. And so what that means is we're growing these new blood vessels, and two things happen when you do that. Every time you grow a new blood vessel, you grow a new sensory nerve. So now you have a hyper concentration of sensory nerves, and these are not regularly formed blood vessels. This doesn't improve your ability to bring nutrients to the area and metabolic waste away. It actually hinders it because there's all these dead ends and irregularly formed blood vessels. So you actually develop what's called hypoxic pain, which is, it's similar to like angina or something where you just aren't getting enough oxygen to the tissue and it becomes very painful. So for the majority of people that we're treating, we're focusing on these changes in the microscopic anatomy, the changes in the collagen matrices and in the microvasculature.
Mm-hmm. So you had mentioned it might take a good long while for me to not feel pain. And, so I'm a go-getter. I'm always on the go. And as you're talking about those laborers in the fields, I mean, I'm not a farmer, but definitely I'm doing 7 days a week of something. So on the back side, I also have a colleague that had back surgery the same week I had my stem cell done with you. And I'm wondering, what is that going to look like for those high achievers if they were to choose one or the other? And in that healing process, the slowing down.
Mm-hmm. Yeah. So what the conversation we were having before was, the importance of being patient, because the reason, so we have this irregular collagen matrix, we have this neovascularization. Well, if one of the areas in medicine that has the best scientific research around stem cell medicine is wound care. And so wound care is, you have like a non-healing ulcer, like you have a wound that just won't heal. And so it's a great thing to study stem cells because it's completely objective. You have a wound and then you treat it and it either goes away or it doesn't, right? And so stem cell therapy has been very effective for wound care. And the reason is you inject stem cells into the area, it grows the new collagen matrix, it grows new blood vessels, and then skin grows over top. So that process takes time. And that's why, because the exosomes have such a strong anti-inflammatory effect, occasionally people get a little bit of pain relief immediately, but usually, and it's usually short-lived, the benefit from the treatment is 2 to 6 months after the treatment. So it's sometimes difficult for people to wrap their mind around because it just, you think something hurts, I think we're so conditioned by like steroid injections that take away the pain right away, but they're short-lived. With this, it takes 2 months before we even really expect to see any improvement. And that's because in order to reverse those things we were talking about, the collagen matrix and the neovascularization, that takes time. This is a lot less like auto mechanics and a lot more like gardening.
Mm-hmm. Mm-hmm. Okay. So what is it that inspired you most to help others in this way? Or what keeps you inspired?
Oh, well, my own personal experience with being treated by Rick was, of course, pivotal. I had an experience a number of years ago where, my practice would, in early 2016, Dave Asprey became a patient. And, I sort of like to joke that after 20 years of working my finger to the bone, I suddenly became an overnight success. And I had this very busy year and I was really tired. I just, over the sort of last months of the year, I was just fatigued. And I thought it was just because I was working a lot. Well, anyway, on Christmas Eve of 2016, I had this sort of like glorious day of just watching football on TV and not working. And my wife came into the room holding our 2-year-old daughter, and she asked me a question, and I went to make a wisecrack, and I had lost the ability to speak. She rushed me to the hospital, and I was admitted, and and I kept having strokes. The right side of my body went completely paralyzed, and so after it took, because it was Christmas Eve, they had a skeleton crew, so it took a few days to get a diagnosis. But after a couple of days, a surgeon kind of burst into my room and sat on my bed and said, "Well, the good news is we figured out why you keep having strokes. The bad news is you have a bacterial infection of your heart, and you are going to need aortic valve replacement in 2 weeks." And I was shocked. I mean, I was stunned. I mean, I'm one of the healthiest people I know. It just didn't make any sense. I'd figured out about a year later that the likely cause of it was from past dental work, from bad dental work. I had some teeth pulled and had these big cavitations in there. But anyway, I didn't know that at the time. But in order to do that surgery, it's a sternotomy. So they open up your chest, and the more slender somebody is, the more painful that is. And it was, for the first time in my life, I got to experience pain that was a 10 out of 10. And it didn't feel like a gift at the time, but what it brought me back to is that the ability to get people out of pain is the greatest gift ever. So what that experience did is it caused me to launch my tithing program. So my tithing program is 1 day per month. We perform stem cell procedures at no charge to the medically underserved. So people who otherwise couldn't afford it, people who are living below poverty level. There's 2 pathways for entry. One is for combat service veterans. I'm happy to do the procedure at no charge for those guys. The other is in exchange for documentation of community service hours. So that's been that really ramped up. I mean, I guess it was before COVID really hit, but that's been kind of my silver lining with this whole last year, is that the tithing program is really in full swing now.
So you mentioned Dave Asprey. Let's talk about the whole stem cell makeover that you did on him. Let's go there.
Yeah. So, Dave became, leading up to when Dave became a patient, I was getting a lot of these Western Canadian farmers and ranchers and Wyoming cowboys and just people who literally had arthritis throughout their entire bodies. On top of that, these are people with a real get her done life philosophy. So I've never billed insurance. And when you do insurance billing, you can only treat one body part at a time. We do your knee, and if you want to do your shoulder, we have to come back and do that later. So I started doing these huge treatments where we do someone's entire spine, and we do both shoulders, and we do both hips, and we do both knees. And I sort of just jokingly started calling it the full body stem cell makeover. Well, then Dave Asprey became a patient. And for those of you, I mean, most people know Dave, like his goal is to live to be 180 and be healthy right up till his last breath. And so, I started thinking about how that would actually work. Like if someone could pull that off, because, if you look at currently, I think the oldest recorded person is like 125. And if you look at them, and they look like an arthritic prune, right? So in order to do that, you'd have to be active right up to the very end. And so I started thinking about sort of proactively treating body parts. So like someone comes and maybe they've got some low back pain, maybe they got some hip pain, but while we're at it, go ahead and just do the whole thing. Well, I started getting his Dave's devotees, and they started asking, well, can't you just do my whole body? And I thought, yeah, actually I can, because I've been doing these huge treatments with these ranchers and cowboys. So we started about 3 years ago, we started doing full body stem cell makeover, which is where we take a large volume of bone marrow, a relatively large volume of fat, concentrate the stem cells from the bone marrow, isolate the stem cells from the fat, supplement with a ton of exosomes, do the entire spine from the base of the skull down to the tailbone, flip the person over, both shoulders, both elbows, both wrists and thumbs, both hips, both knees, both ankles, and great toes. People have the option of also having Amy Killen, my practice partner, do what she calls skin and sex. So she does the skin of the face to improve elasticity and hydration. She does the scalp to thicken hair follicles. And in women, she does the vagina, and men, she does the penis to improve. Well, in men, it's to improve microcirculation because that's really the cause of erectile dysfunction. In women, it's primarily to improve elasticity and hydration of that tissue, and to maintain the integrity of the pelvic floor, especially if someone's aging.
And so, how old can somebody be when they're doing this process? I mean, we talked about that aging
Mhm.
and how quickly, people can recover based on their current baseline of health, but what does that look like?
We've done, we generally wait till people are 40. We generally don't do full body stem cell makeover under the age of 40. Just because, you wouldn't want to do this too many times in your life because it's such a large volume of bone marrow. Like I wouldn't recommend doing it more, like at the very most every 5 years. And even then, like I'd rather start a bit later because I don't want to do this too many times in somebody's lifetime because it's a huge commitment and it's a big blood loss, and which is fine. So we prefer for people to be at least 40.
Okay. And what's the recovery time like after that? I'm taking
Surprise.
notes. I'm only 42. I can come back in 5 years, right?
It surprisingly, we do all of our procedures under IV sedation by an anesthesiologist, as you know.
Yes.
So people go blissful, which is different from general anesthesia. It's very gentle medications that put you to sleep, but you're still breathing on your own, and it's not like uh, general anesthesia, which is very hard on the brain and liver. It's very gentle medications. So people go to sleep, and then the full body stem cell makeover takes about 3 hours of like constant poking. And when I have visitors, like they're shocked because it looks like the Spanish Inquisition. And then people wake up and they're fine. It's like sort of, I'm still kind of surprised. Like you think they're going to wake up in all this pain, and amazingly they don't. People are sore, and the next day people are pretty sore, but not unbearable, just uncomfortable. And then people bounce back pretty quickly from it.
So where you're injecting isn't specifically because they had a previous trauma in those locations. It's just general wellness and
Well, because
upgrades.
there's two types of treatments we do here. We do a la carte treatments, and then we do full body stem cell makeover. So a la carte, excuse me, is what we did with you, which is where we treat the problematic areas: low back, neck, shoulders, whatever it is. About half of our patients say, well, if I'm going to do this, we may as well just do the whole thing. And then we do the a la carte portions, plus we do everything else.
Mm-hmm.
And people would say, well, doesn't it dilute the efficacy? Doesn't it sort of like take away from the problem areas? And I just haven't found that to be the case. I found it to have sort of a synergistic effect.
Mm-hmm. Okay. And then one of my colleagues said they had it put in an IV. Can you tell us about that?
Yeah, sure. The FDA hates that because it's like a systemic treatment. We just treat joints and that sort of thing. But when we do these big treatments, like it's it's kind of the equivalent of like an intramuscular injection. So it's still getting into your general circulation, just not directly through the vein. When you go into the vein, that's mostly if you're treating like somebody's internal organs.
Okay.
It's going to go to the lungs, and it's going to go to the liver, and it's which is if you're treating that, that's great. I'm treating musculoskeletal structure, so I want to get it right where the problem is, which generally doesn't have great blood flow, and then it's going to be picked up into general circulation anyway. So
Okay. Okay. So what's the future of stem cell medicine looking like? What do you
yeah,
believe
I
is
have no
possible?
idea. I have no idea. There's two categories of stem cell medicine. There's what I do, which is regenerative medicine, where we take the stem cells, we put them where the problem is, and then we sort of just like step back and let nature run its course and God in all of his infinite wisdom. And then there's tissue engineering. And that's probably where the most exciting stuff is, like the thing to really watch over the next number of years that's going to be just mushrooming with activity. That's where you could actually like grow a kidney or a meniscus, grow any kind of body part in a lab for surgical implantation.
Wow. Wow. Well, what do you believe is possible for the human body in healing and progressing with this type of science? I mean,
Oh,
this is incredible.
I think there's no limitations in the area of regenerative medicine. I mean, I've got a pretty good thing going here. I'm sure there'll be advances. I know there's advances being made in exosomes because there's different types of exosomes, and so you can do like condition specific exosomes. The main thing is we just need to figure out the regulation, because we need to figure out for sure what is kosher and what is not, because there's a lot of gray area currently. But I think there's a lot of abundance in the universe for all of this stuff, and there's a lot of great work to be done.
So are those gray areas just based off of us being in the United States, or is there
It's partially that. It's yeah. I mean, I mean, I practice in the United States, so yes.
Mhm. And what do you think is possible based on reducing stress in these body parts that we are treating? What do you believe is possible with reducing stress by way of the nervous system to enhance or optimize somebody's life experience?
Well, living with chronic pain is extremely stressful. When there are these studies where, these motion MRI studies of the brain where it shows brain activity. And in order for the brain to function properly, all the attention goes to one area of the brain. So when you're talking, you're in the language section. When you're doing something that involves spatial awareness, you're in that area of the brain. And what the brain does is it sort of quiets, the other areas quiet down so that one area can have all the attention. Well, when you're in chronic pain, that lights up one of the areas of your brain. And if it hurts all the time, it never turns off. So it doesn't allow for that concentration of energy in the area of your brain that you want it to focus on. So living in chronic pain is extremely debilitating. People don't sleep well. I mean, it just impacts every area of your quality of life. So, you know, low back pain is the leading cause of disability worldwide and the number one reason people go to the doctor. So, I think stem cell therapy is perfectly positioned to reduce those numbers dramatically.
Mhm, mhm. So if people wanted to find the stem cell solution, your documentary, how could they see that?
Sure. So it's stemcellsolutionfilm.com. It's free to watch. I want people to learn more about this stuff. So I encourage you to come watch the film. I've got a bunch of my star patients in there. Dave Asprey's in it. Mark Hyman's in it. Jim Quick is in there. John Gray. Got a lot of my favorite a lot of my favorite
Yeah.
patients in there. I encourage people to watch it and check out our website, docereclinics.com, DOCERE clinics.com.
Do you feel like there's anything else that you want to clear the air on with misconceptions or miscommunications about what stem cell can do?
Probably the main thing is like, we only really get this like on Facebook, but it's, oh God, please tell me you're not using dead babies. Nobody uses dead babies. Like, and like nobody uses dead babies ever. Like, there's no reason to use it. I think the confusion people are making is talking about embryos, which are not babies. It could be argued that it's a human life, but it's a ball of cells. It's not like it doesn't look like a little person. It's a ball of cells.
Yeah.
Those are not used therapeutically.
Mhm.
The reason they're not used therapeutically is because they just don't work that well. They're so primitive, they tend to turn into all different types of stuff. And on top of that, it's illegal in the United States and nobody uses it. So, like, don't worry about, there's no dead babies involved. The only thing that is used occasionally are these birth tissue products like placenta, like umbilical cord. This is like live, natural, healthy births. And then there's this birth tissue that otherwise is going to go in the garbage, and we use those tissues.
Yeah. Yeah. I love that
No
part.
babies were harmed.
Well, and you're a dad. I mean, I'm a mom. I wouldn't want to have that conversation, but I do appreciate you pointing out the healthy way we get to use that to promote a healthy life.
Mhm.
Well, this has been wonderful. Thank you so much for sharing your time. And I'm excited to hear from others about reaching out to you. Thank you so
Well,
much.
thank you. And I'm so excited to see you improve over this next couple of months.
Thank you. All right, everyone. I'm your host, Tricia Reid, and this is Dr. Harry Adelson, my guest. And I'm so delighted you could all hear this conversation. Have a great day.